So let's move to the another topic of gynecological disorder, that is about cryptomenorrhoea. So here is one of the question. The cryptomenorrhoea is best described as a absence of menstruation due to hormonal imbalance, painful menstruation with excessive bleeding, menstrual occurring, bleeding occurring but not visible due to the outflow obstruction, and the scanty menstruation with irregular cycles. Okay, so let's move about the what are the answers. Okay, so absence of menstruation due to hormonal imbalance, this is amenorrhoea. Okay, so this is amenorrhoea. Painful menstruation, the painful menstruation, we called it as a dysmenorrhea with excessive bleeding, which is menorrhagia. Okay, so this painful menstruation, the other name is your dysmenorrhea. Okay, excessive bleeding is called menorrhagia. Menstrual bleeding occurring but not visible due to the outflow tract. So what happened here? The uterine lining is forming. Okay, the menstruation is always there, but there is some problem in the outflow tract, and the bleeding does not comes out. So if there is an menstrual bleeding occurring, so what is the clinical sign of this? The patient may complain of abdominal pain. Okay, so there is an cyclic abdominal pain. So cyclic abdominal pain is there, but the menstrual bleeding occurring but not visible due to the outflow tract. This is mainly due to some obstruction. This is called as an cryptomenorrhoea. Okay, we will do the latter part, the elaborate way. Now, scanty menstruation with irregular cycle, this can be due to so many reasons. Okay, here the answer will be the menstrual bleeding occurring but not visible due to the outflow tract. Now, what happened in the cryptomenorrhoea? The menstruation, which is the condition in which the menstruation occurred normally, but the menstrual blood does not comes out due to there isn't some problem in the outflow tract, and one of the most common reason is imperforate hymen or the transvaginal septum. So this is another important MCQ or the very important questions for your NEET-PG or AIAPGT. So what is the most common cause for the cryptomenorrhoea? That will be the imperforate hymen or the transverse vaginal septum. So basically, cryptomenorrhoea, it is a congenital anomaly of female genital tract. What happened here? Here is what happened. There is failure of the canalization of the inferior end of the vaginal plate. So what happened here? This is one of the important like anatomical based question. What happened? There is a failure of canalization of inferior end of vaginal plate, inferior end of the vaginal plate at the junction between the urogenital sinus and the vagina. So what happened? There is a congenital anomaly. It is a rare anomaly. Here, the vaginal, basically the inferior end of the vaginal plate, the failure of the canalization of the inferior end of the vaginal plate with that of the urogenital sinus. Okay, so this can be asked. The most important, what is the most common cause? The answer will be the imperforate hymen. So here, suppose in this type of the cases, suppose in clinical oriented cases, a patient who is about 13 years old. Okay, so suppose she is only of 13 years old and or the 14 years old, and she has come to your clinic. Okay, she came to your clinic with a complaint of that I have a pain in the abdomen, which is every month the pain is occurring, and I don't know what is the reason, but I always feel tender in my lower abdomen. So if you examine the lower abdomen, what you will see, there is an like tenderness, okay, in the lower abdomen, and plus there is some bulging in the vaginal intraosseous, okay, in this, especially in the vaginal opening. So there is a bulge swelling, bluish tinge bulging in the vaginal opening, okay. So these are the some causes, congenital causes and the acquired causes. In the congenital causes, the most common cause is your imperforate hymen. There are some other acquired causes, for example, cervical stenosis, post-surgical scarring, pelvic inflammatory disease, trauma to the cervix or the vagina. So remember this, what are the congenital causes and what are the acquired causes, okay. Now, this is a clinical based question. Suppose a 14-year-old girl present with a cyclic lower abdominal pain. Cyclic lower abdominal pain, that means menstruation blood is forming, okay, and and this is happening every month for the last 6 months. But she has not attended the menarche. Means the blood is forming, but the outflow tract is closed so that no blood is seen outside. Okay, so that is why she has not attended the menarche. On examination, secondary sexual characteristics are developed and the bluish bulge is seen in the vaginal intraosseous. Okay, the bluish bulge is basically your hematocolopus. Okay, colopus. So basically, the blood has accumulated in the vaginal intraosseous, and which is also known as your hematocolopus. So what are the reason? Here the answer will be your cryptomenorrhoea due to the imperforate hymen. Okay. So remember, this is one of the cause of the primary amenorrhoea, the cryptomenorrhoea. One of the rare cause, not a very common cause, but the rare cause of primary amenorrhoea. And here the patient is present with that of the cyclic abdominal pain. All the secondary sexual character develop, but when you palpate the or when you examine the vaginal opening, you will see that a bluish tinge, okay, or bulge. So cyclic pain suggested, and the bluish bulge in the intraosseous is a characteristics of the imperforate hymen. And the how will you diagnose? Suppose a patient come to you in your clinic. So there are the two things you should do. Either you go with the ultrasonography or the MRI, or with the help of your naked eye, you can see that there is some bulging in the tenderness in the lower abdomen. Okay. Now, if you see this diagram, now this patient, suppose sometimes this type of question has also they can ask you the age of the patient will be your 13-year-old female, okay, and she came to the OPD or in emergency clinic with acute retention of the urine, in acute retention of the urine. So when you palpate the abdomen, what you will see, there is a tenderness in the abdomen, also bulging of the abdomen, okay. And she also give you a history of recurrent abdominal pain. She also give you a history of recurrent abdominal pain, okay. The patient could not attend the menarche, but secondary sexual character has developed, okay. So what you will see, there is a suprapubic swelling is present, and on the bluish tinge there is some suprapubic swelling is present, and distant swelling bulging from the intraosseous. Okay, so these are the feature of cryptomenorrhoea. So what they can ask you about your what are the clinical feature of cryptomenorrhoea, what are the causes, what is the most important causes, what happened actually in the cryptomenorrhoea, okay, why it's happened, because of the failure of the canalization of the lower inferior end of the vaginal plate with that of the urogenital sinus, okay. So these are some of the questions they can ask you from the only from the cryptomenorrhoea chapter or the points.